The province of Ontario has budgeted more than $50 billion for healthcare in this fiscal year, and keeping a lid on those costs for next year and beyond, well, that's on many government to-do lists. Health economist Wodchis has also given some consideration as to how that might get done. He's an associate professor at the Institute of Health Policy, Management and Evaluation at the University of Toronto. Walter, welcome to TVO.
Thanks very much.
You can't see it here, but I'm giving you the magic wand.
Oh, okay.
I'm giving you the magic wand. I'm going to give you 5 areas within the healthcare system that you can wave that wand and immediately improve, and as a result, we're all going to be grateful to you for the rest of our lives. Let's start with Pharmacare. What do you do?
So first, that we expand coverage to cover all people for all necessary medications.
As opposed to just those who are lucky enough to have a good health plan at work or be seniors or on social assistance or whatever.
That's exactly right. Okay. So many people, and we have many, for the people transitioning into the workplace, do they get coverage, do they not get coverage? Right now, really only seniors and people who are otherwise on disability insurance have any kind of guaranteed coverage. And we need to really manage that.
Okay, that's Pharmacare.
Yeah.
Number 2, doctors. What do you want to do about them?
So physicians do a great job on their own seeing patients, but they don't see themselves always as being part of the broader system, or not many of them do. All other healthcare is really part of a system in some way. They're mostly employees, and they feel very tied to their organizations. We need physicians to be more tied to other parts of the healthcare system. I think one way to consider doing that is to think about how they're paid. Right now, they're paid mostly for individual one-on-one brief encounters with people.
Fee for service.
Fee for service, and to think about more salary type models where their compensation can remain at the same levels, but it's on a different platform, such that there are still some incentives to see people, but by and large, they're thinking, how do I help other peers and other colleagues in the health system better manage care, particularly for people with multiple chronic conditions and complex care.
Should a doctor's compensation to be tied to whether the health of the patient improves?
So I think that they should be tied to the overall health of their patients, but not to whether any single individual's health improves, because there are many aspects to that that are beyond the physician's control.
Okay. How about us, the population? What do you want to do with us?
So I think that the population, we really need a social movement for better health, better healthy lifestyles, less salt in the diets, more exercise, better eating in general, and then the health system to help with that, but then also when some people still do get ill, is to have a population-based management approach such that those with more complex conditions get more care and better coordinated care. And it really should be a different kind of care if you have 4 conditions versus if you just have, a flu, and that's all. Because I can get dealt with very quickly in a physician's office in and out, whereas if I have multiple conditions, I need someone really to help me manage, maybe 5 or 6 different specialists, 17 different medications. We need a different system, and we have the same system that does both because we don't really think about it in terms of population management.
Gotcha. Number 4, EHealth. We've been promising EHealth for a decade and a half already. Where are we?
So we are not very far along. There are some systems in a physician's office that do keep track of their patients electronically. There are systems in hospitals that keep track of their patients electronically. But if you were to think about how the banks work, you can go to any bank, and in fact, you can go online and pull up all your recent transactions, and in many cases, dive in and see, well, what was it for? So we need an enhanced banking transaction system that not only tracks what it was that we've seen in the last little while, but a little bit more around what the conditions are, what treatments were applied, and that should be accessible from anywhere just as easily as you can with your banking system right now.
You know what's crazy? Last time I went to my GP, I asked her about this, about the EHealth, and she said, we're still $1 billion later, more than $1 billion later, we're still in a system where her computers can't talk to the computers at the hospital. We don't have that kind of integrated electronic health sharing records. How's that possible in 2016?
So it's not totally easy to implement these systems, and people get scared often about privacy or who knows what. People get scared about having a single vendors with, say, larger coverage. People get scared about how information might be used to monitor even the performance of physicians. But if we look internationally at all the programs that have been highly successful in implementing integrated care or bundled care or better coordination of care, every single one of them has an information system that talks to each other. Every one.
Okay, I've given you the magic wand for Pharmacare, physician engagement, the population-based management, EHealth. You get the magic wand for one more thing. What do you want to do?
I think we really want to be able to see how well we're doing on all of these things. And for that, we need really good measurement at the individual level. So we've started to think about not only does the hospital do a good job, or does the physician do a good job in monitoring their diabetes patients, but think about people. How well do we manage the care, and what are people's experiences like as they traverse through the health system? So if I have a planned surgery that I need, what was I like at the beginning, before I had my surgery? How did the surgery go? And what was my health like 90 days later or a year later? So that's following the individual's patient to find out what their outcomes and what their experience has been over time. And I think we need to take that to say, that's the value created by the health system, and to that we can also attach the costs. And now we can think about, where do we get the best value for people's care for our money, and use that really as the benchmark.
So we need more Walters to check it out at the end of the day.
Oh, or better systems. we had a system to calculate costs, used to be called Get Walter, and then we replaced it with Get Cost.
Good. Well, we're happy to have this Walter here in our studios tonight. Walter Wodchis, University of Toronto. Thanks so much.
Thank you very much.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.